This is the main danger of vitamin D. In this video, I'm going to tell you 6 major dangers of using vitamin D. When I say vitamin D, actually, it's a hormone that's known as a vitamin. Did you know that? And what are its functions? Why do we need vitamin D so much? How does it work in the body? What are the reference values? What are the consequences? Everything here in this video. So, to start, let's understand the functions of vitamin D. There are two main functions. The first is the so-called classic function, our bones. Our body needs vitamin D to be able to absorb and make use of calcium and use it properly. If you don't have vitamin D yet, you might even take in calcium, but your body won't absorb it. So, the classic function is its role in calcium metabolism and also its function in the bones. But what do bones have to do with vitamin D? Our bones and our body need calcium. If you don't have this calcium, if your vitamin D is low, you need calcium to survive. So our body will take calcium from the bones. This makes the bones weaker as the body takes that calcium and puts it into the bloodstream so your heart can keep beating, for example. So that's the main function, the classic role in the bones. There are other functions too, other roles of vitamin D, like in immunity, inflammation, and fighting infections. In our central nervous system, it's also been studied a lot lately. There are studies showing that people with low vitamin D have a higher chance of developing depression. In our cells, so vitamin D has several other functions. These are the non classical functions. These have been studied a lot lately. So, vitamin D doesn't just have a role in the bones, it's not just about calcium either. But that's the most studied function, the classic role, although there are others too. And what will happen? When you start having too much vitamin D, which is one of the big concerns, and actually the topic of this video, which I've already made before, a video talking about low vitamin D, but now it's time to talk about high vitamin D. So, what is the ideal level of vitamin D in our blood? For you to get these benefits and avoid the risks, which I'll mention here, the 6 risks of vitamin D, between 30 and 80 nanograms per milliliter. If you're in a country that uses millimoles per liter, which many countries do, to get this value, you need to multiply by 2.5, and then you'll have the ideal reference range, which is between 30 and 80. This value I'm talking about here isn't exactly a worldwide consensus, but it's pretty close to it. And some protocols say that for people without any risk factors, for example, no autoimmune diseases, not elderly, and no other factors, you could set this reference range a bit lower, between 20 and 80, okay? And for the upper reference, some protocols go up to 100, okay? More than 100, then yes, that would be a problem. I like to use a reference range between 30 and 80 because here we can cover a well studied range. Agreed? When we start taking vitamin D, I often see patients who are using extremely high doses of vitamin D. Or sometimes their body absorbs that dose really well, and the person ends up not doing follow up tests to check if their vitamin D is too high. And what are those risks? That's what I'm going to talk about here. But I know you're gonna ask, what is the average dose of vitamin D? In general, between 1,000 and 2,000 international units. For most people, 1,000 international units per day will work well. I know there are some videos talking about 10,000, 50,000 international units, which is completely absurd and will bring a lot of consequences. Just to highlight here, those are extremely rare cases. If someone has a problem absorbing vitamin D, then yes, that dose can be used safely. However, that's not the rule, okay? The protocol recommends an average dose between 1,000 and 2,000 international units, depending on the condition and the previous vitamin D level. Many countries also use micrograms. If that's the case, you need to take the international units, for example, 1,000 international units, and divide by 40. Then you'll get the value in micrograms, which would be the daily amount. Just a reminder here that I'm talking about general values. There are even people who will take less than the amount I mentioned here, will have ideal levels, and others may even need a slightly higher dose. Well, since I worked for many years in emergency medicine and now I also see patients who are hospitalized, the patient goes to the emergency room. In this case, I'm not there anymore, but they are seen by someone, and the emergency doctor refers the patient to me. So I know very well what's happening at the emergency room level. I experienced this in practice. These are people who are using higher doses of vitamin D, and this will lead to a series of consequences for you. And what are these six dangers that you need to be very careful about when your vitamin D starts to increase in your blood? Going over 80, going over 100. You have to be very careful. What's going to happen when your vitamin D is elevated? You'll absorb calcium from your diet, but you might absorb too much. So you can end up with too much calcium in your blood, which we call a hypercalcemia. And hypercalcemia is extremely dangerous. So, what are the six dangers? The first danger of vitamin D is nausea, vomiting, and weakness. Vitamin D isn't at a high enough level to affect your heart, for example. You'll see that I'll talk about this, but you already start to show signs of weakness, fatigue, and tiredness. Your physical conditioning or fitness decreases. You used to be able to climb 4 flights of stairs. Now you climb one and you're already tired. Or you wake up already feeling tired. You have muscle weakness, you can't do your usual activities anymore. This could be because of increased calcium. Even a slight increase in calcium can cause this because calcium is involved in our connections. You need calcium to survive, as we've discussed. So that's the first point here. Whenever a patient has this complaint and is taking vitamin D, you have to check their calcium and vitamin D levels, okay? The second big danger is arrhythmias. When calcium levels in the blood go up, along with high vitamin D, what can happen? Calcium is essential for heartbeats. This can cause electrical instability in the heart, leading to arrhythmias, which is extremely dangerous. Many times I have to hospitalize patients because of this effect on the heart. The third big danger of vitamin D, and here it's not necessarily when it's high, but it's the lies about vitamin D. Often people start taking vitamin D and then they start taking these combos like magnesium, vitamin K2, even ginkgo biloba. A lot of times they're mixed together with some herbs in there. One time I came across a patient who was using rosemary extract. There's nothing against rosemary extract, nothing against it at all. But you have to be very careful with this because many substances can have a harmful effect on your body. If you don't need it, then yes. That's where the problem lies, since I mentioned vitamin K2. A lot of people ask about this. That's why I listed this as danger number. Is it really true that you need to take calcium, vitamin D together with vitamin K2? Because vitamin K2 would be the GPS for calcium, guiding the calcium to the right place, right? From a scientific point of view, according to the American Society of Endocrinology, okay, it's not just my opinion here. This isn't an opinion video. This information is a lie. Not all patients will need to use vitamin K2. I, for example, only prescribe it in selected cases. Most people don't get vitamin K2 because scientific study protocols show that it's not necessary to guide calcium, okay? There is no scientific proof. Even though many influencers with tons and tons of followers end up spreading this, which, from the internet's point of view, for those watching, ends up becoming the truth. However, in science, this hasn't been proven, okay? The same thing goes for other substances, other minerals that are used together with vitamin D in these combos. Magnesium, for example. Not everyone who takes vitamin D is going to use magnesium, so you have to be very careful. If your doctor prescribed only vitamin D, then just take that prescription. Try to take as few substances as possible. because that's how you'll actually achieve better health. The famous less is more. Have you ever seen this? So, this whole story about the calcium GPS is a lie until proven otherwise, right? That is, until scientific studies actually show it. At the moment, they don't show that. According to the American Society of Endocrinology, there is no such general recommendation, okay? The fourth effect is the effect on the kidneys. There's also a lot of misinformation that excess vitamin D wouldn't be harmful because you could just eliminate it through your kidneys. Is that true or false? That's false. You saw that vitamin D is a hormone. So, unlike other vitamins that you take and any excess gets eliminated by the kidneys, vitamin D doesn't work that way. It can build up in your body, causing serious consequences. And one of the problems is exactly in the kidneys, which can lead not only to an increase in kidney stones, but also it can cause kidney failure. So be very careful with vitamin D. It's a big risk, okay? You really need to pay attention to this issue of kidney stones, kidney problems, and also kidney failure from weak kidneys. Danger number five is using vitamin D without supervision, without checking your vitamin D levels in your blood. Why? How do you know if your levels are good? That even with supplementation, you're not deficient? Or, on the other hand, that they're not too high? It's really hard for you to know. Or else you're just going to wait until you have those signs and symptoms I mentioned at the beginning of the video, like having some bone problems or osteoporosis, before you start doing something about it. So you need to get regular blood tests to check your vitamin D levels. But how often should you do it? That's a big question, and it really needs to be individualized. Some people will get tested every year, but if you're just starting supplementation, you should do it more frequently. And while we're talking about blood tests, when it comes to vitamin D, you need to be a little patient. Because what's another big mistake? A big risk? Someone starts taking vitamin D, and the next week they go get a blood test. But vitamin D isn't something that increases overnight. It can take weeks, sometimes up to 12 weeks, to show a true result in our blood. So the person goes, takes vitamin D, even a high dose, and their vitamin D levels don't go up. Then they think they need an even higher dose. And that's where the danger lies. So each time you take a higher dose, and when it finally shows up, you already have hypercalcemia and other signs and symptoms of vitamin D excess. So be patient. There's no point in getting tested every day or every week. You need to give your body some time to absorb it. This is a big risk. It's either not monitoring or over monitoring your vitamin D. And danger number six, excess vitamin D. Using vitamin D without proper monitoring. That's because when your calcium levels are high, there's a greater chance it will deposit in your blood vessels. And now you might be thinking, wait, didn't that doctor in the video just say you didn't need to track your calcium so closely? So how is he now saying that it can deposit in the blood vessels? Because the key here isn't to use vitamin K2, but rather to maintain ideal levels of vitamin D to prevent this from happening. So we can avoid this risk of calcium depositing in the vessels, which could lead to calcification and increased cardiovascular diseases like heart attacks, for example, by using the correct doses of vitamin D. And not just piling on more and more supplements. That's how we manage to maintain ideal levels, the ones I mentioned earlier. So, yes, calcium can deposit in the blood vessels when vitamin D is in excess, causing calcium levels to rise too much. Just a reminder, right? This isn't going to happen if you eat food with calcium, for example, or if you take vitamin D just once. It happens when vitamin D levels stay high, raising the calcium in our blood and causing what's called hypercalcemia. That's when you can have several consequences in your cardiovascular system, your kidneys, and throughout your body in general. On a scale from 0 to 10, what score would you give this video? If it's a 10, I'll make more videos like this one. Also, let me know here if you take vitamin D or not. I do. Why? Because I work at the hospital, so I can't take advantage of the sunlight. Yeah, the sun is out there between 10 a.m. and 3 p.m. I can't even get 10 minutes to catch that sunlight to produce vitamin D, so I need to supplement. And you? Where do you live? Right here. The city and country where you live? I'm speaking from Porto Alegre. Now, I'm going to leave a recommendation for you to watch. It's a video about vitamin B12. What are the signs you might have? A lack of vitamin B12? Did you know that in some groups, up to 30% can have a vitamin B12 deficiency? Are you at risk or not? So, watch this video here and learn more about the signs of vitamin B12 deficiency. Take care. See you next time.